Three types of preventive medicine, including primary prevention, secondary prevention, and tertiary prevention. Primary prevention, in which measures applied to prevent the occurrence of the disease. So let's prevent the disease. And the secondary prevention, where a disease or its complications are inherited or converted at any point after the onset of disease. So we want to use the secondary prevention to identify early onset of the disease and arrest the programs. If primary and secondary prevention fail, we have tertiary prevention. The tertiary prevention is for the treated disease. In these three different types of preventions, primary prevention is the most important and the most difficult prevention. The primary prevention comprises manipulation of man's environment, his water supply, the air he breathes, also the manipulation of man himself by such measures of immunization against the infectious disease. So the primary prevention is prevention of disease or injury through reducing exposure or risk factors. But it is very difficult to find the factors or the hazards. So that is why the primary prevention is the most difficult prevention in the preventive medicine. There are many examples for the primary prevention. For example, German measles virus prevention. We know the measles took a ton of million people a year from in the whole world, especially in the developing countries. So for the children, nowadays we use the measles virus vaccine to keep children far from the disease. And nowadays we also try to have the novel coronavirus vaccine to protect us from respiratory disease. And we have another example, talk about primary prevention. In this slide, you will see the high blood pressure can increase different disease, including CHD and stroke. So, the primary prevention of hypertension is we go to have an education program. This education program is a lifestyle modification for a primary prevention of hypertension. We can have different methods to do something for the hypertension. We can increase physical activities. For this education program, we can see that we also can weight loss and moderation of alcohol consumption. These 6 different methods in education programs which can help us to reduce the high blood pressure. And after the study, we can see from this slide, before the intervention, that means before the education, the stroke, CHD, it increased. But after intervention, we can see if we reduce the just 2 millimeters of mercury, then the stroke will reduce. The reduction in the risk of stroke will be 6%. If we reductions in BP in 5, we will see the number will be the 14 reduction in the stroke. So that means education programs is working to do the primary prevention. What is the secondary prevention? The secondary prevention is identification and the control of disease process in their early stages, thus limiting their effects, which means the people is already be a patient. So which we can do is detect and correct the departures from the good health as early as possible. For example, we can do the physical examination for the workers to evaluate their health condition, and reduce the prevalence of disease and disability. So physical examination is one kind of the measure in a secondary prevention. And the tertiary prevention is limited to the impact of disease or injury once damage has already occurred. For example, we can do the rehabilitation. We can do the rehabilitation or the treatment. The rehabilitation also including the psychological treatment. So after rehabilitation or the treatment, we want to minimize the adverse effect of the existing disease or the injury that can make the efforts to prevent complications and disabilities of the patient. So we have 3 different levels of preventive medicine, including primary prevention and secondary prevention and tertiary prevention. The primary prevention is the most important prevention in a preventive medicine. Find the risk factors and control the risk factors through education or some other methods which can help the whole population keep in health.